Alrighty, y'all. I see quite a few folks are coming in, so we'll go ahead and get started. See a lot of folks already engaging in the chat, y'all, are one step ahead of me because I definitely was going to ask you guys to do that. Hello, and welcome to the second installment of the I Don't Know How series presented by the Center for Resilient Families at Arizona State University and Mental Health America. I'm Kendra Lucas, and I am a research associate at Mental Health America, and I'll be your moderator for this webinar. An alarming increase in suicidal thoughts and death by suicide among America's youth over the last years indicates an enormous need to act now. In this webinar, My Child is Suicidal and I Don't Know How to Help, we will explore personal experiences faced by parents who learn their child is struggling with suicidal thoughts, teachers who support youth struggling with suicidal thoughts in school, and providers who help youth and families negotiate recovery from suicidal ideation. We also have a part 1 to this series on bullying, and if you would like to view that recording, you can visit the first webinar in the link provided in the chat. Thanks, Jackie. This webinar is being recorded and will be available for attendees to access within a couple of weeks. Live captions are enabled for those who need them as well. We also want to emphasize that this webinar is meant to be engaging and conversational. So we want to hear from you, and a lot of you guys have already started doing this, but I'm just going to prompt everyone else who hasn't. Feel free to use the chat option to tell us your name, where you're watching from, and if you feel comfortable, if you have any personal or professional experience with those who have suicidal thoughts. You'll see my example listed on a slide. As a research associate, I work with a lot of data from people who experience suicidal thoughts. So that's what brings me here today. You can also use the Q&A button at the bottom to ask questions, which we may answer in chat or we'll pose live to our speakers. Lastly, we do recognize that this is a sensitive topic, so we encourage you to practice self-care and only engage whenever and wherever you feel comfortable. Please note that the language surrounding suicide has changed over the years to become more sensitive and accommodating. If you're unsure of how to engage in this conversation, there are a variety of resources available, including the ones I'm posting in chat. So, without further ado, let's meet our speakers. First, we welcome our parent advocate, Shannon Crossbear. Shannon articulates her purpose as demonstrating and promoting gentle healing. Her own community and family history propelled her to develop leadership in order to address disparities that have led to poor outcomes for friends and relatives. Shannon's work has included facilitating and consulting with the National Indian Child Welfare Association, the Federation of Families for Children's Mental Health, Georgetown University, the National Child Traumatic Stress Network, and the University of Montana's National Native Child Trauma Center. Ms. Crossbear is skilled in trauma-informed community engagement. She has worked with supporting organized stakeholder voice and representation at local and national levels through various behavioral health initiatives. Next, we have our resource provider, Lene Higgins. Lene is a mental health writer for Mental Health America. She has a Bachelor of Arts in English from Hood College and holds a highly qualified Maryland Educator certification. Previously, Ms. Higgins was a middle and high school English language arts and avid educator in Baltimore County and District of Columbia Public Schools. Her advocacy and passion have led to changes on a classroom, school-wide, and district level, and to quote a former principal, helped inspire hundreds of students to find their voices. Her writing has been featured in Blavity, The Educator's Room, and several other digital platforms. Ms. Higgins is a passionate mental health advocate who believes that meaningful storytelling has the power to change lives. Last, but certainly not least, we have Dr. Steve Koza. Dr. Koza is a professor of psychiatry and pediatrics at the Uniformed Services University, where he serves as Associate Director for the Center for the Study of Traumatic Stress, or CSTS, and is responsible for the Child and Family Program. He is a graduate of the United States Military Academy at West Point, New York, received his medical degree from the George Washington University School of Medicine and Health Sciences, and retired from the U.S. Army in 2006 after 25 years of military service. Dr. Koz's professional interests have been in the areas of clinical and community response to trauma in both military and civilian communities, including the impact in deployment and combat injury and illness and death on military service members, their families, and their children. I don't know about you guys, but I'm feeling very underqualified right now, just based on our panelists and their experience. But no, seriously, I am very grateful for the amount of diverse perspectives that are represented on our panel and within the audience. So we just thank you all for being here to discuss this important issue. So I'm going to stop sharing my screen so we can get into the discussion. And we're going to kick this off with a testimony from Shannon, and just hearing a little bit more about her story. So Shannon, can you share a little bit about what brings you here? Get us into your personal testimony. Shannon, you are muted.
I'm famous for that muting business. So I just want to say, I'm going to say a few words in my language because that's important to me. Anin Indue Maganak Minagijikad. I just wanted to greet you in the Ojibwe language as my relatives. I start in that space. So my name is Shannon Crossbear, and you heard all that stuff, right? But basically, I come to this conversation as, you know, a mom, a sister, a grandmother who has, whose life has propelled her to talk about suicide, to work in suicide prevention. And so that's what I come, you know, that's how I come to this conversation. And I just want to recognize, you know, as I was watching, you know, how many people are coming from all different directions in this country. And so that makes me feel really good because it's so important that we have this conversation, and that I recognize that if you're in this room, there is a reason that you're in this room, and I'm grateful that you're here. So my story, or part of my story, is that my family, we were on a tribal community. I am the mother of 6 sons, 3 biological sons and 3 sons through adoption. I lost my middle son, Brian, at 19 to suicide. In our communities, we were always aware of suicide because we grow up with that knowledge that as a people, we have greater disparities, and, you know, so it's not like a subject that's off limits. We all know about it. But that's a totally different thing than actually experiencing it, right? So, and about 20, I mean, it's been a long time, about 22 years ago, my son, Brian, was having suicidal ideation. And it kind of came on pretty suddenly. Brian was a happy individual. I think he had some mood stuff that was happening when he was a teenager. But, you know, he seemed to kind of, yeah, that kind of hung on a little bit. But there came a period of time where both myself and his friends became concerned about him. And he, you know, it kind of started out with, we're very traditional, spiritual, participate in ceremony kind of people in our community. But he was talking in terms that depending upon the context, it wouldn't alert us, but it became, so for example, it's nothing for us to talk about, talking to spirits or having spirits talk about us. In fact, it's an expectation that will happen. But there's a difference between that and when we began to get concerned about kind of the ideation they say that he was having, like the way he was talking. And so his friends and his relatives, supported him in addressing that. And it took some time for him to do it. But he began to have suicidal ideation, and it not only concerned all of us, it concerned him. And so we were able to talk to him and to get him to self-admit into a situation. And he was scared enough that he did that, right? That he could not control his thoughts about suicide. So he entered into a psychiatric unit, and he died on that unit by suicide while on suicide watch. So, and so our family was left with this big, huge hole about, first of all, like, wait a minute, everything we've been taught is to get this person to safety. And we did all of this, and yet this was the result. So what went wrong? And so, I began to learn about that because it was so, it was just such a shock, of course. And then all of the fallout with, I had other children, and I was concerned about them. I was concerned about my community. And I was left with this, to kind of deal with. And since then, there has been a lot of instances where I have been able to talk with other families who have both had that outcome and more positive outcomes where people were actually recovered from their suicidal ideation or from their attempts, or, so it's, and even within my own family, we had an outcome with another one of my sons that was a great outcome where, was in peril at a point in time at one age, and now he's, much older, he's successful, he has a family, he's doing well in life, he's healthy, mentally, spiritually, and emotionally healthy. So, so that's kind of my story about why I came to this conversation.
Shannon, I think I speak for the entire webinar when I just want to say my condolences for the loss of your son. I know reliving that story and telling over and over again, and it may not get any easier each time you do it, but we just are very grateful that you're here and volunteering your time. You talked a little bit about, or you touched on how your son was at a center and wasn't getting the proper help that he needed and unfortunately passed. You have any insight to what was going on at the center and what they were or weren't doing to support your son?
Well, yeah, I learned afterwards, of course, after the fact, that what it meant to be, to have a gold standard of suicide prevention, and things like line of sight and making sure you were creating a safe physical environment so that implements that could cause harm were not accessible. So all of those kinds of things that were part of how, but what I also learned was how broken our system was in terms of when I began to say, because at first I thought, oh, this is like some kind of anomaly. I mean, it's like, this is weird that this happened. I mean, here we went. And then I began to see how many times suicide completions had happened in hospital settings, emergency rooms, psychiatric units, treatment facilities, detention centers, and all of the places that one would think that they would seek help and safety. And so I began to think about how, so what does that mean in terms of kind of how do we as parents, as community members, as people out here in our lives start to be able to create situations that were safe, right? And I don't mean just physically safe, but emotionally safe. If our systems were not able to do that, while we worked at how we could make those systems more accountable, right? And that kind of thing. So yeah, I was really, really surprised. I mean, and as a family member then, and as a parent, and as a, someone who loves other people, I wanted to make sure that, when the situations arose, that I knew the questions to ask, right? And indeed, later in my life, it came in handy, because when my youngest son had a mental health crisis when he was 19, you can imagine the trauma of that, and he needed to be hospitalized for a period of time, I at least knew the questions to ask. And I knew how I could be involved in helping to, to monitor and helping to create the safe space, not just physically, like I said, but emotionally and mentally, and how to inform so that what was being done was culturally congruent, that it really resonated and worked for our family. So
Shannon, all of these words you're using, they're just firing me up. Accountability, culturally congruent, like all of that is so, so important. And I'm glad that you were able to kind of figure out, okay, you've been through this experience, so what do I need to do to make sure that the next child doesn't go through the same thing? Which leads me to my next, well, I'll ask both of these questions. How were you even able to figure out how to approach this issue? And you've already kind of touched on, knowing what questions to ask. What other advice or tips would you give parents, or what else have you learned on your journey through this?
Well, I think, first of all, it's the scariest thought ever. Like, we as family members, as people who love other people, as parents, as clinicians, because we get into that work because we care, right? So all of those places and spaces are places, like, the very thought of losing someone is so awful that we don't want to hang out there, right? We glance at it, we think about it, we just move right on. Or you think about, oh, what would happen if my child ran out in the middle of the street and something happened? I mean, it's horrible, it's horrendous, right? And so we don't, and I guess the encouragement that I would have is really, we need to face those things. We need to talk about those things, because the reality is that it does happen. And it happens more frequently than we think. I mean, one of the things I learned when I came back to my community, and I had to find a way to tell my community, but I also had to find a way to create and share space for folks, is how many people, even in my own little circle, and I live in a rural community in northern Minnesota, that I had no idea how many people in this small, sparsely populated area had experienced the death of a loved one by suicide. It was, and yet we were all in our isolated kind of experiences. So the power of being able to create and maintain that space to have those things, so that you can talk about what does it mean to prevent, right? And how do we prevent? And I always think of things from my own worldview and perspective. So I'm always thinking about, what does that mean physically? What do we need to do physically to keep people safe? What do we need to do mentally for ourselves to inform ourselves and find out more about, what does it take? And sometimes it's not the clinician. Sometimes it is, but sometimes it's the mother in the neighborhood that has the full refrigerator, right? That's the gatekeeper. She's the one where the kids go after school. And if you can keep her refrigerator full and you can get her some training, her intervention for prevention is, has a whole different outcome. So, being able, and then the other thing, being able to change our language around health so that we don't think of behavioral and mental health as we talk about, going to the doctor, and a lot of times people are talking about primary care, and they think about primary care as physical care. But when we switch our language to understand that primary care is physical, mental, emotional, and spiritual well-being, then, and not just physical care, we have more opportunities to kind of address these things. And as a public health issue, I mean, the percentage of, to have it as the third leading cause of death for certain age groups is, that's a public health issue. So why are we treating it differently than we treat other kinds of illnesses or disease?
Shannon, I couldn't agree more. Mental health is a part of overall health. And when we think about, the question, are we healthy? We should be thinking about the overall picture, the whole, in every single aspect. What are we doing to make sure that we're okay? Any other comments about signs or, any of the work that you're doing? We can talk a little bit more about that if you like.
Well, I think in terms of signs, we oftentimes, we want that answer. We want that magic thing that says, well, if Johnny hasn't showed up, or Johnny's in his room too much, or, Sally seems to be sad over a longer period of time and we can't, whatever that is. And I think those are very important. There are lots of great trainings out there that can help you kind of identify, be alert to those signs. But that's why it's so important that we engage everybody in the conversation, because there's things that I'm not going to see, right? Sometimes because, my grandkids are hiding it from me, but sometimes it just isn't in my, what I'm seeing. And that's why engaging everybody in the conversation and really thinking about how community can work together. And I think that's also true on the other end of what I would call postvention. It's like after something has happened, how do you ensure that everybody is getting what they need, so going forward, right? Because there's a lot of grief that doesn't get attended to because we still have all of these myths around suicide. That makes sense. So I think it really is making sure that you're engaging in that conversation, and not, again, it's not when we stop having it as such a secret, right? As such a, all of the things that come with, and we can do that. I mean, we absolutely can do that because we've done it with other things. I mean, I remember as a young child, people would never talk about cancer. It was the C word, right? And people, I'm old, I'll admit it, I'm like older than dirt here, but that it was that reality, and there was so much shame involved and so much stigma involved. And we have another opportunity to kind of change that conversation. And the fear that people have about, if we talk about suicide, we're going to encourage suicide as another option or another choice. We have to stop giving messages that just are not true, especially in a population that has experience so much disparities and racial inequities. And I say that because one of the messages out there in our tribal communities was always this message about suicide is a permanent solution to a temporary problem. Guess what? It's not a temporary problem. It's not a temporary problem. And when you say a lie like that, because tomorrow morning I'm still going to be impoverished. I'm still living in a community that is experiencing high levels of violence. I'm still living in an inequitable community and country. So those are not temporary problems. And to say that is to dismiss the very real concerns. And instead of talking about, how do we create the shields that I always talk about it like there's a shield. We have all these arrows coming at us, whether it's poverty, whether it's, social injustice, violence, gangs, whatever, they're all coming at us, right? And what's the difference between when those, I call them arrows, the arrows of risk, whether it's ACEs, adverse childhood experience, where they're coming at us all the time. But what's the shield that prevents those arrows from mortally wounding us? And building those things on those shields of what I call the shield of resilience, culture, language, community, caring adults, trauma-informed, asking what happened as opposed to what's wrong, all those kinds of things that build up that shield. Those arrows, we need to take care of those arrows, but that's a long-term kind of thing. And today what we have to do is just make sure that the arrows don't penetrate and mortally wound. So I know, I'm very passionate, of course, because I'm passionate about life. And we are really talking about, life and death circumstances. So thanks, Kendra.
Oh, Shannon, you're just so eloquent in the way you've said stuff I've been wanting to say, just don't know how to say it. So I just really appreciate the verbiage you've been using. And these analogies, these phrases are really hitting home for me, and I know a lot of people in the audience. So just really, again, appreciate you for being here, for sharing your testimony, for giving people real guidance, real love, real life experiences, real advocacy. Like, we just really appreciate it. You guys feel free to send her praises in the chat. If you have any questions for her, please send them to the Q&A box. But I want to go ahead and move forward with our panelist Q&A. So I want to talk to Lene and Steve a little bit. You can also pose any questions to them in the chat if you'd like. So just to kick this off, and either of you can start, it doesn't matter. I'm going to ask you both of these questions. Is there anything that stuck out while you were listening to Shannon share her testimony? And did any of it kind of resonate with any personal or professional experience you have with this subject?
I don't mind starting. Apologize in advance if I cough. So much of what Shannon said resonated with me as an individual who's struggled with suicidal thoughts, as well as an educator who've had students. I've had 2 students die by suicide, and many other students tell me they had suicidal thoughts. And when Shannon said, how do we create emotionally safe spaces, that really stuck out to me, because we have to talk about what people are going through, and we can't shy away from that. So being an ELA teacher, when we read things that dealt with suicide, racism, violence, poverty, divorce, we had to talk about that. And I couldn't say, oh, thanks for sharing and shy away. These are real experiences that students needed to talk about, and I needed to listen in that moment and hear them. Something else that Shannon said that really resonated with me is we have to face these things because they happen more than what we think. And we need to engage everyone in the conversation. And And there are just so many times where I felt like parents communicated, hey, this is what my child is going through. And we were able to make a plan, or we were able to help that child in that situation. Support looks like different things for different people. So in my teaching experience, when a child came to me and said to me, Ms. Higgins, I'm thinking about hurting myself, or Ms. Higgins, I feel like I have no one to talk to. Those were moments where I knew that I had to listen, validate, and act. And I know that as a teacher, my resources were limited, but I could listen to the child. I could talk to the counselor. I could call the parent. And these are things that I did in order to help my students who were struggling. And then one other thing that I do want to share before I hand it off to Steve is a story about a student that I had. So the day after one of my former students died by suicide was like one of the hardest days of my teaching career. And I remember there was a student in my class and he was just sobbing, and he didn't want to talk to me. He didn't want to talk to anybody else. And he just cried openly. So I went over to him and I said to him, I know this is hard. It's hard for me. And I know that when it's my planning period, I'm going to close my doors and just cry because that's all I want to do. But there are people here today in the library that you can talk to about what you are feeling right now. So I'll write the pass, I'll put it on your desk, and you can decide if you want to go. I'm not going to force you. And he cried and cried for about 10 more minutes, and then he grabbed the pass and he went. And the next day, he came to me and he said, thank you, he really needed that. And that wasn't the end of our conversation about what he was feeling. He came to me throughout the school year. But what I share the story to say that sometimes all you need to do is just be there. Be there. I'm very passionate about this because, as I said, I had 2 former students who died by suicide. And I'm also passionate about it because of my own struggles. And I think that sometimes as adults, we have a misconception that we understand everything that children are going through. And we really don't, because we have not been children in this time period in 2022. We don't know what they are facing. So when they come to us and they say, support me, this is what I need. And it might not come through as support me, this is what I need. It might come through as I have no one to talk to, or I feel like a failure. We have to be there to listen and receive that. So I'm going to pass it over to Steve. Thank you.
Thank you, Lene. Thank you for, just listening to everybody speak. It's just moving, and I think it's powerful and important. Shannon, I want to send my sympathy to you and your family for the loss of your son. I mean, the story is heartbreaking, but I also am incredibly impressed how this has driven you to become the advocate that you are, and how you go out and you spread the word in ways that are really important for other parents to hear. One thing it did resonate, and I feel it's important to say, it's both sad and scary that the system that was designed to care for your son, it feels like it failed him. And I think it's scary because, particularly for parents, we want to make sure that parents feel comfortable and know that when they're seeking out services and looking for help, that the help that they're getting is appropriate and is there to support and is going to do the job. So that really is extremely important, that parents feel comfortable with the professionals that they're working with if they seek out professional help, and that they know the right questions to ask to make sure that they're dealing with people who know how to manage the problems that they're coming to them with. I think that's extremely important. Another thing that has been raised a number of times, I just like the kind of way of thinking about developing communities of care, because that's really what we're talking about. It's everybody who's engaged with children, whether it has to do with family, parents, siblings, friends, peers, teachers, coaches, healthcare providers, all recognizing the fact that suicide is, as has been mentioned, a public health issue for our children and for our teenagers, and that we all need to be thinking together about how to be looking for children that may be at risk or demonstrating signs or symptoms that they are at risk for suicide, and that we're open and available to talking with those children and addressing those problems and communicating amongst ourselves as well. So a community of care is interlaced. It's not just one person doing something. It's everybody talking with everybody else about what's going on, and if there's a risk that's identified, addressing it and making it, even within a small community of a teacher and a counselor and a parent, developing a way of addressing it that's appropriate. I wanted to just briefly mention this idea of myths that we've been talking about, and there are many, many myths about suicide. One of the myths that I specifically want to address that resonated with me in the conversation is this idea that we don't address suicide and then it's taken care of and it goes away. It's something, particularly people who are at risk, if in fact suicide is a part of a person's life, we need to be assessing that and addressing it as it changes over time. So if a teenager expresses suicidality, even if a professional screens that person and feels like they're not at imminent risk, a week or 2 weeks later, that risk may change. And we need to be prepared to identify and address it because it can change over time. The last thing I want to mention is this idea about talking about suicide and parents having words that they can use. So very often this is a subject that parents are fearful of talking with their children about. We need to ensure that parents feel comfortable asking their kids how they're doing, recognizing if in fact they're withdrawing, if they're not doing well in school, if they've become irritable, if they've given hints that they're feeling like it's not worth it anymore, that parents can ask questions like, I'm worried about you. I want to make sure you're okay. Are you in fact thinking about doing something to hurt yourself? Are you feeling like you want to die? Asking questions directly to children. We don't instill ideas with kids by asking those questions. A lot of people think we do, but we don't. And in fact, what it really communicates, the important part that it communicates is, I, as your parent, I can hear anything you have to tell me, and I can talk with you about anything you have to bring up to me. It becomes a line of communication that they may not be sure is available to them. So I'll stop there and look forward to the continued discussion.
Thank you, Steve, Renee, for those wonderful words. And I appreciate that you guys were dropping little nuggets of wisdom in there. I guess, since we've gotten our little advice, we got to hear a little bit about you guys' experience with this topic. We can probably go ahead and jump into some audience questions. I saw a couple for Shannon, so I'll go ahead and pose this to you. One question asks if your community hosts some type of special event to honor your son's life. You're muted.
Sorry, I did it again. No, nothing specific. It was such a weird thing that happened, but I'm going to share it because it was so impactful, is that they were doing like this little play, this women's anthology, and I needed to tell my community about what happened, right? And so I said, oh, I'll do a little piece about Brian's death, right? I don't even know. I mean, it was like a month after. I was in total shock. It was kind of, you'd think it wasn't a good thing to do, but it was, because what it ended up happening was I was able to tell my whole community what happened, and I didn't have to tell that story again and again and again. And I got to tell it in a way that honored Brian's life, right? And so it wasn't a detailed, oh, this happened and this happened and this happened. it was, you know, more the story of Brian's life. And it was so powerful that what it did was it opened up the conversation in the community about suicide. So, and it wasn't honor. I think there's always been this, you know, we don't want to honor the act. And so then how do we honor the person without honoring the act? And we don't want to encourage, there's all kinds of things. And I think it really depends on your community and what you need in order to heal. And that can be very different given what the cultural context is. But honoring whatever that is, I think, is important. Hope that helps.
Thank you, Shannon, for that. I'll follow up with another question. So we have a situation from Jen. She, and I guess I can pose this to Steve or Lene, or Shannon, if you want to chime in too, that's fine. But it looks like the situation is her child has mentioned suicide before, has went through treatment, was released from treatment, but is now talking about suicide again. And there seems to be some family friction as Jen is trying to figure out how to solve or mitigate this issue. But it seems that all of the family members are not in accordance or at a loss of how to even deal with this. So she seems to be stressed. So how can we handle a situation where we have a child who is suicidal? There might be some family tension going on and everybody's at a loss of what to do. So where are the means of support? How can we rally behind the child to make sure that they get the best care possible?
I'm reading through Jen's comments and trying to understand. I think any time that we have a concern about a child in terms of suicidality and potential risk, even if some members of the family, if I understand it correctly, may not share that level of concern, it's important that we act on it and that we seek out services and get help for that individual. And that part of that treatment can actually be bringing the family in to have a conversation so that there can be a clear and unified way of thinking about supporting the child or communicating to the family members who may not be recognizing the level of severity, why the treatment is important and why it is important for that individual to be getting help. So in some ways, this gets back to the comment that I was making earlier. Sometimes we feel like, you know, psychiatric issues are not like surgical issues. We don't get an operation and then it's done. Typically what happens is we get care, but we need to continue to get follow-up for care. Sometimes that can be really challenging just because of access to mental health services, which I know can be limited in some communities, and it can be really difficult. But it's important to engage whatever healthcare services you have. So even if you can't find a mental health provider, talking with your primary care provider, mentioning concerns about suicidality will certainly set alarms off in the healthcare system to try to find access to care for a child who's in need. And maybe others have some thoughts about that as well.
Yeah, thanks, Steve. I guess what I kept going back to is listen to yourself. I mean, if you have a concern and other people don't share that concern, don't allow that to be dismissed in yourself. Find people who will listen to you, who will support you. And if it's not within your immediate family, then, you know, there are certainly things that, I mean, we now have access in ways that we didn't before, where we can reach out and find a community that will validate your, you know, your gut reaction. You know your child, you know when those signs are kind of, you know, like, well, this just doesn't land right. I know that he went to, you know, treatment, but now there's some things that I'm seeing that are concerning me, and, you know, that's what's my, it's like, so if you're wrong, great. you know, your error on the side of, you know, of caution, great, whatever. And even for people, for me, who have dismissed other relatives that I've been concerned about or whatever, you know, I give them, I mean, I'll own it. I'll say, you know, I understand that you don't share this concern, you know, and I may be way off base, you know, and this may be more about me than anything else, you know, humor me, help me, you know, so that I don't have to get stuck in a right or wrong, you got it right, I got it wrong situation. It's just, it's too important. We're talking about people's lives, so, and their ability to breathe in and breathe out again. Yeah.
Perfect way of putting it, Shannon. It looks like we are over time, so unfortunately, any other questions we can address. If you would like to contact us and ask us these questions, you are more than welcome. I'm going to share my screen again. So once again, we've sent out a bunch of resources. I didn't expect you to just have them all together. So I'll get a document ready so that when the webinar link is sent out, we can also send out all of these resources I posted. But just some highlights: the Suicide Prevention Lifeline. I posted a bunch of articles from the MHA website. Lene is a fabulous writer. Please go read them. And then our gun safety campaign toolkit. Steve touched a little bit on firearm safety and why that's important to this subject. So there's a lot of cool resources there. And then our first webinar, which again, we'll share this link with you. If you'd like to watch it, it is on our YouTube, so feel free to do so. And then our contact information. So I just want to, again, share my gratitude to Lene, Steve, Shannon. Thank you all for joining us today, for volunteering your perspective, for giving some very, I think, valuable advice. I've learned a lot today. I've learned a lot about how to start that conversation. So really appreciate you guys being here. So if you have any follow-up questions, feel free to contact us. I've also did a little plug for MHA screening. If you'd like to take a free, anonymous, and confidential mental health screen, just go to mhascreening.org. There is a parent test on there. So if you would like to do a test for your child to kind of see what's going on with their mental health, that's also available. And then our social media. So I'll stop sharing. I'll post our contact info in the chat for you all. Yeah, once again, thank you to everybody for joining us today. This was a heavy topic. So, you know, please, after this webinar, if you want to, you know, take a deep breath, woosah, meditate, whatever you need to do, please do it. Take care of yourselves. Please enjoy the rest of your day, enjoy the rest of your week. We hope to connect with you all again and do this all over again with another important mental health topic. Yeah, so thank you all. I'll be closing the webinar in about 60 seconds. So get your thank yous and your goodbyes in, and we'll see y'all next time.
Thank you, Kendra.
Thank you all. Thank you guys for your support and collaboration. Really